24th of October yearly is set aside to celebrate World Polio Day globally and the Rotary International in their fight to eradicate polio at zero level. And in commemoration of this year's World Polio Day, the Rotary Club of Sapele Urban, as part of the club fellowship, have hosted a panel discussion with the team Improving Immunization Coverage, a panacea to polio eradication, with a special section in providing valuable insights into sustaining Nigeria's polio-free status and strengthening community immunization, or unveiling what it takes to improve immunization process. The panel of discussion saw the presence of stakeholders from the health sector in Sapele local government area and other public health experts who discussed on the panacea that means the solution to all problems, exploring other areas that the Rotary Club International over the years in their humanitarian services, funding and fight against polio, and make people to build confidence on them. They spoke on new strategies of a wider coverage and to engage in key activities like sensitization, announcement, and to be fully involved in planning, implementation, and beyond, so as to achieve the target of polio at zero level, because once a child is infected with polio, that child is paralyzed. They advocated for the government to be fully involved in the area of funding, engaging more health officers in the field, and enact a law to prosecute schools, churches, mosques, and parents who refuse to support in children immunization. Also, as part of activities, the club also visited Amukwe Health Center to donate consumables to the center in promoting immunization against polio. Matron of Amukwe Center, Kikiru Rita, while receiving the items, lauded Rotary Club of Sapele Urban for the gesture as she prayed for more blessings upon them.
My name is Mrs. Rita Ikikiru, a matron in this Amukwe Health Center. We are very happy. We are very happy to assist us. It will go a long way to serve the children in this health center. It will help to prevent so many things. So I'm actually happy. May God reward Rotary, the Rotarians, because they take time to come and to present this to us. So God will reward them.
Rotary Adama Oguwebere, past Rotary President of Sapele Urban, and other panel of discussants who spoke to Rero TV appreciated the health experts on their various areas of recommendation, as Rotary will further engage their members in all areas until every child is free from polio.
Okay, I am past President Adama Oguwebere from Rotary Club of Sapele Urban. October is polio month, and this particular week is polio week. 24 precisely, it's World Polio Day. Now, in time past, Rotarians and Rotary clubs, especially in my club, we had done so many activities towards eradication of polio. For example, just last year we gave a solar freezer to Urban Health Center. But we had noticed that even with all these, we find out that there are still gaps. And we felt that having a panel discussion to discuss before, during, and after everything that goes into the act of polio immunization will sensitize us and help us know where to come in, hence this discussion. The discussion so far, we have come to understand that, yes, the international partners, of which Rotary is one of them, and the government, they are putting in what they think is their best. But we at the grassroots will discover that we do not need to keep quiet. Like we all know, Rotary International is a humanitarian organization, and we help the government to fill in and stand in the gap. Now we think that the best way to go now is for Rotary to be involved in the pre, during, and after. For example, when this information is being sent out, Rotary should be made aware, and we should be at the forefront, because just like the doctor said, Rotary International is now a brand name. People know us, and they know that when we come, we put our words to action. We're people of action. And so when we go out to tell these people that they need to partake in this immunization, when we move out and front immunization, we believe that would have more input. Even during and even after, we're encouraged to also train to be surveillance officers to make sure that no child is left unimmunized.
I'm the apex nurse of Sapele local government. Local government have a lot of role to play First and foremost, they have to really ensure that any school, any church, or any parents that rejects our people from vaccinating the children should be sanctioned. And by the time they come out full force to do this, you see that most of the schools will be scared to say the parents did not allow me, or the pastor is saying don't come and give. That is one. The local government also can help in recruiting more teams in addition to what the state is bringing, so that we'll have enough workforce to go into the field.
I'm Dr. Okoba Obatawe, a public health expert and LQS supervisor. The Nigerian government does not see health as a priority number one. While some aspects of the government are trying, getting facilities and this, but we've never prioritized the welfare of healthcare professionals in this country. And so you see that whenever you talk about funding for healthcare professionals or funding for events, it becomes a major problem. So you look at immunization programs that we talked about. Most of the funding is coming from international partners. When you ask the state or local government to fund this thing, the program automatically dies. When you ask the federal government to fund it, automatically dies. So it gets to that point in time whereby we should be self-dependent, self-sufficient, and handle things ourselves.
I'm Rotary Untumonu Matilda, the Polio Chair, Rotary Club of Sapele Urban, and the site rep for Zone 4 and 5. Today we are at our adopted health facility, Amukpe PHC, for continuation of the activities where we have vaccinated some children and also donated some consumables to promote polio and immunization activities in Sapele. And the theme of this year is every child, every vaccine, everywhere. And that is why we are here this morning to be part of the World Polio Day celebration, aiming that at the end of the day, we are going to kick out polio completely.
Good morning. My name's Rotary and Fred Ikponsa, the Assistant Governor, Zone 4. It's a tradition that as Rotarians, we come out every 24th of October to come and immunize children from 0 to 5 years. And we are here today in Amukpe Health Center, courtesy of Rotary International via Rotary Club of Sapele Urban to do the immunization. And we are done with the immunization. And I also want to encourage families, parents to see it as a good innovative for them to bring out their children for immunization, so that we can say we'll eradicate polio out of our system and out of the society.